We are so lucky. Not only do we have our hospital, and actually we have 2 clinics in town. We have a surgeon. A lot of small hospitals do not have surgery available anymore. We have the optometry within the community. We have mental health in the community. We have drug and alcohol counseling. We have 2 pharmacies. We have physical therapies. We have chiropractic. So we are able to provide a holistic approach to healthcare, which I think is quite unique for our community. I have done home health, I've done community health, and within the hospital, general nursing, surgical, and I'm currently in the outpatient department.
One of the major things in rural South Dakota especially is people intuitively know that healthcare is a scarce resource, and because of that, I feel that people tend to be more appreciative of the care that they receive, especially in their hometown communities. They have a high degree of respect for their healthcare professionals. You're able to see the people and patients that you treat in the community as well, whether it's the grocery store or out for supper or whatever. It's you run into people quite frequently.
Winter's got a really deep sense of community. There's lots of functions where the whole community shows up to, whether it's sporting events, fundraisers for people in need, and just a appreciation of each other in the community. I grew up playing at Leahy Bowl, and when you bring somebody to Winter, that's one of the attractions. You go to show them and you tell the history behind Leahy Bowl, and Frank Leahy being a coach at Notre Dame and originated from this area.
Small communities are really great. You know your neighbors know you. Our school system is wonderful. The swimming pool, the library. There's so many things for kids as they grow up. And it's nice to be in this open area where you feel safe to let your kids walk to the pool or walk to school.
In town though, you've got every opportunity to go to any business that you want. Several grocery stores, local hospital of course. Main Street's got several businesses that are active, and the community tries to provide everything it can here locally without having to go places to get things. If somebody came here to work at a hospital or a clinic and their spouse is looking for something, there's, I think, endless possibilities. There's ag support jobs, meaning implement dealerships, repair shops. The job opportunities in Tripp County in Winter right now are probably endless. If you're moving here and your spouse has an opportunity to work at the hospital or clinic and you've got your own business, there's some tax advantages from a business standpoint that could help you, further your career in that industry.
One of the things that I think has become more and more specialized or unique to our facility is the amount of outreach clinics we're able to have. We have cardiology, we have pulmonology, we have orthopedics, we have urology. We have all these physicians that are able to come into our facility and provide those specialty areas so families can bring, especially their elderly parents, here instead of having to make that 3-hour trip somewhere else. We probably have positions open in every area of our hospital at this time.
We do have quite a few incentives, especially for our RNs and LPNs and CNAs in terms of sign-on bonuses to actually incentivize people to come to the area. Growing up in this area, my wife and I, we tend to share a lot of similar values. It's neighbor helping neighbor, and that's the way that our community thrives.
Winter is a very friendly community. It is a community that it's small, but yet you have your privacy. Your neighbor, you know your neighbors know you, and it also has many opportunities via the community system. The healthcare system is amazing. The first responder system is awesome. We just have a lot of opportunities, and as you become acquainted with the community and get involved with the community, I think that you would find that you would be very happy in this area.